I have severe type A hemophilia. I'm factor VIII deficient. And as a hemophilia patient, I would need to go to the hemophilia treatment center every month or so to pick up my factor. In early 1980, I was offered a home care pharmacy to service me, and I jumped at the chance and saw how that worked. And the pharmacy staff would bring the factor out to my home when it was convenient. They'd bring it to my work if I needed it. And in so doing, I realized that is really what I wanted to do. I partnered with Linda Hurst, a lady that I've worked with for many years at the previous company. She's a pharmacist, PharmD. I partnered with her, and we decided to buy a pharmacy. So we bought a little tiny medical building pharmacy in 1995 called Herndon Pharmacy. Our intent and goal has always been to provide excellent customer service the way we would want it provided to us. I don't have any grandiose plans to be, this huge company, but we want to be a solid, tight-knit company that provides excellent customer service to our patients. I do what I do because I have hemophilia. I want to help. I want to provide a service that no one else can do the way that we do it. Most of our employees have hemophilia, or they're mothers of people with hemophilia. In addition, my adopted son has hemophilia. Because of that, we're entrenched, we're networked with the hemophilia community in California. Because of our level of understanding and compassion and empathy, we can provide that service that others just can't. They don't understand it. They don't know it. They don't live it every day. Our guys do. Our reps do. Our customer service people. They know this disease in and out because they live it. My brother Scott, he also had hemophilia. He was 2 years younger than I. And in 1993, Scott passed away in his home. We were with him. And he was infected with HIV and hepatitis C, and as a result, he died of liver failure and HIV disease. And that was a very emotional, obviously, time for us, and so it really hits home. So we understand this disease. We know this disease in and out. We've been in the emergency rooms bleeding. We know what a knee bleed is. We know how painful it is. So we understand the concerns. We understand the fears. We understand the everyday living with the chronic disease. And whereas someone off the street or some marketing person, they may have knowledge about hemophilia, but they haven't lived it. They don't understand it. And we understand it. It's part of our lives. It's part of who we are. And that is what sets us apart from everybody else. Our patients, they're not just customers, they're longtime friends. We're dealing with a chronic disease, so it's not like we have a patient for a year or 6 months. We have patients that we've had since day one. We know how much factor they use. We know how much supplies they use. We know how much they're going to need in any given month based on their history. So it's a very strong relationship, very strong bond that we have with our customers. I believe this is what I was supposed to do. This is what I was called to do. I've considered not doing it, and there's just no way. I mean, this is in my blood, if you will. I have to do this. It's just part of who I am and part of what I know I'm supposed to do. I believe God put this in my life for a reason, and He took my disease, my affliction, if you will, and has used it through me to touch other people and to help other people. And instead of this disease conquering me, I feel in a way I've conquered it, because I'm using it every day to help others. And I hope that's a good thing, because it sure makes me feel good.